Okay, Ken, we're just getting started on this right shoulder. We're looking in from the back to the front. Everything that you see is magnified about 30 or 40 times on the screen. Right out of the gate, we can see a little bit of old suture material here that we can remove pretty quickly so we can see better. There's your biceps tendon. And your rotator cuff is going to be at the top of the screen here. We'll keep working here, show you some more in a little bit, but that's basically the hole in the tendon that we've got to work on today. Okay, so now we're looking at the rest of the shoulder. We're inside the joint here, and we're looking down the front. And that looks pretty good. We'll look up here. Just look straight up on the arm for a second. I don't see anything else other than some redness in the soft tissues and the joint capsule and some of the ligaments. I don't see anything else to worry about. We'll swing around here and look towards the back. Same thing, a little bit of an inflammatory reaction or inflamed tissues, but I don't see any labral detachments. You really don't have a lot of arthritis here. There's not a lot of loss of cartilage. Okay, you can let go. So we're going to come back and look at this biceps anchor to see if that is something that needs attention. You had a prior slap repair many, many years ago, which is why there was some suture material there. And we can see that this biceps is a little bit torn here, but not too bad. The actual anchor side, it looks like that slap lesion healed. Okay, so we're up in the subacromial space. This is the torn edge of the rotator cuff here. See that? It's a big tear. This is posterior, so we always like to try and get this repaired and pulled up. We're going to start with a spinal needle just to check our angle of insertion here for our suture anchor. That just gives you an idea of how far back this tear really goes. So you can see some of the old suture material. Yeah, I think we're okay for the moment. I'm just changing my angle here. To get far enough posterior for you, I think we need to get that sort of angle. There you can see that. Okay, pause. Is this going to be a big tear? Okay, so we replaced our first anchor way in the back of the shoulder. We're going to use these suture tapes to capture this infraspinatus side of this tear. We'll show you what that means in a minute. But first we'll take a crochet hook. We're going to come in from the front of the shoulder on the right side of the screen. We're going to look at these tapes and take one at a time here. So we'll show you some more in just a minute. Okay, so we've got the two posterior sutures tied. That's holding down the most posterior part of the tear right there. We've still got a ton to fix here. all the way up to the front, but at least we've got that posterior anchor down, and now we're going to get to work starting in this region here. I got it. Okay, so we've passed another couple sutures, and it's starting to look more like a rotator cuff tendon here. 1, 2, 3, 4. We've still got a big hole in the front. We've got a triple loaded anchor in now, so we're going to go ahead and start fixing the rest of this anterior cuff. Just wanted to show you in the interval here. Okay, so we've got this massive tear repaired. I'm just rotating the shoulder now, just making sure everything moves together. And that looks pretty good. So we're going to finish up there and get you back to the recovery room shortly. We'll obviously take it slowly in the recovery initially, but then we'll get you moving. I really hope this does the trick for you, okay? We're just looking towards the front of the shoulder there. There's our triple loaded anchor, and then we have 2 fiber tapes. Okay, take care now. Bye-bye.